order, and I'll ask the Lord's blessing on our gathering tonight and our decision to make with men do as He would have them do. So, amen. We need to approve the agenda. I don't have an agenda in front of me. That's it. It just looks different. Got somebody new running the place. That's what it is. Let's adopt the agenda. Is there any objection to adopting the agenda the way it's presented? Anything to add or take off? If not, ask for a motion to approve the agenda.
I make a motion to approve the agenda.
Second? Any discussion? All in favor, say aye.
Aye.
Opposed? All right, so we had 2 meetings with minutes of which we need to approve. They're in your packet. I'm hopeful that everyone's had a chance to review them. Are there any additions or deletions or corrections to be made? If not, I'll entertain a motion to approve the minutes for those 2 meetings.
So moved.
Is there a second?
Second.
Assuming no discussion, all in favor say aye. Opposed? All right. Do we have anybody here that wants to make a public comment? They have to schedule those with us? Good. Welcome, Amanda. Thanks for being here. Let's go to fiscal update. There he is.
I do exist.
A new hairdo.
Exactly. Thank you. It's just freshly done 2 days ago. Good evening. I think it's been a while since I've been in front of you guys. This is the financial update as of May 31st, 2022. You have the packet right there in front of you, also on the screen as well. These are the numbers as of May 31st. The first slide for you is the actual revenue, expenses for the year so far. Through so far, we should be at 92% expended for 11 months. As you can see, our total budget, we are at 70.1%, which means we are 22% under budget this year. So we have done, once again, I credit the staff. They've done a really good job of staying under budget all year long and making the county happy. Any questions? I will note that figure administration is high because that's the catch-all account. That is the one that catches all the, I guess you guys know when Kevin and them do the budget, when they do the budget, they say, instead of going through all these accounts, they say take it out of this one big account, and that's why that number's that way.
So is this expenses?
Expenses, yes, sir.
The new director does not get to take that difference and put it in the pocket, does she?
No, not now that I'm aware of.
Tim, is there any
Yes.
particular reason why it's that low? Is there anything specific?
We have been very fortunate this year, or unfortunate and fortunate. We've been fortunate enough that we've been able to use some COVID monies to offset salaries and other departments, but we're also unfortunate that we've had several vacancies this year. And therefore, there's nobody in that position, and therefore there's no money to spend for salaries. And that salary kicks in. So I think especially like someone like the WIC director who's been almost 6-7 months without a WIC director. So and other places we've been out of the nurses, some nurses have been staffed for almost a year now. So that's caused it. Plus some of the nurses working in COVID clinics get offset by some of this COVID money. So any questions? Okay, the next slide, it will be the revenues for the agency. As you can see, once again, we should be at 92% collected. We are only at 76.9, so we are currently under collections. as I have stated before, especially with our family planning, maternity, STD clinics, and I know at one point in time we were behind on billing, and I'm afraid to say that we are still behind currently on billing. But the health director and I worked on the plan. I think she might have something to say about that, about how to get that fixed. We have not been able to catch up since we had 2 staff that were out. So there's a plan. I'll let the health director talk about that later if she wants to. But once that gets caught up, we'll be back to normal. Any questions on that? Okay. The next slide is just a accumulation of that last slide I just showed you, but in chart form. This lets you see where we are this year compared to where we were the last 2 years. As you can see, in most places we are underperformed. Some places we've underperformed in last year. You'll see HIV. We've overperformed. That is because we were able to bill for some stuff last year that we were able to come into. Immunizations, you'll see is up. The reason that is up because that's the COVID vaccine is in that number. So any vaccine we got is in that immunization number. As you can see, STD, family planning, our core services, maternity, they are all down this year. Any questions? Okay, the next slide is going to be just an overview. This lets you know what at the beginning of the year, what our budgeted revenues were, 22, you can see what we've collected. So we're short 525,000 at this point in time. Expenses, we're to the good 1,316,000, which lets you know right now the health department is operating on a excess of $790. That means what the county has budgeted us for to spend, we are $790,000 under budget. So, like I said, we've done a really good job taking care of our money.
Could I ask a question?
Yes, sir.
Could you say a word about child health? Child health, where do we go there?
The child health clinic was actually put on hold for right now. I'll let Donna, if she can explain.
We don't have a child health clinic. We assure, with pass-through funds, for children who are uninsured or underinsured that need, physicals, that we work with Purcell Clinic who do those physicals and then send us the bill for that. We pay for it. We changed our child health nurse position, which was an enhanced role nurse position, to a child health nurse that would do postpartum and newborn home visits, but we still have not been able to hire for that position. So we don't have a child health clinic in that sense, but we do still have to oversee some of the funds that are given to this county for child health services. Does that help?
Yes.
Any other questions on that before we go to the next part?
We
Okay.
have to advertise for the child health nurse though, and I think that closes the 30th
Close tomorrow.
tomorrow, I think.
Tomorrow, the 30th. I think it's tomorrow.
Okay. To the next slide. I did want to let you guys know that I have not been here in a while, and I did want to keep you abreast and aware of our COVID funding because, as you know, at the beginning, they were just throwing money at everybody and say, here's this money, do something with it, but you can't do but this and this and that with it. So as of this year, this is the funds that we currently have. Anything you see grayed out means we did not get that money until that following month, so we could not spend that money. So your big 2 pots of money are that 453 and the 7016. 453 is for contact tracing and for PPE and any other supplies that we need. The 716 funds are only for vaccination clinics or things for use in the vaccination area. As you can see, and all these balances will roll over to next year. So when you see this 225 or the 232, they roll over to next year. So it's not like we lost that money. It's still there. Okay. The state has allowed it to move over to next year. The three at the bottom is the school liaison, which we've talked about before. That was the liaison with the school system. We never were able to fill. The CD pandemic recovery, that's some additional money they gave us to help with, communicable disease. Donna's got that money. She's got ways to spend it. Like I said, it rolls over, so we're not losing anything. And then the last one is the 620, which is, they gave us more monies to go to the schools and make sure the schools are ready for, COVID. After the schools had already opened, they gave us, the state's fee is about a little bit behind, right? So they gave us more money, so now we're sitting there with 164,000, 115,000 to be used for the schools, where the schools got their own monies for COVID. So we're trying to find creative ways, me and health director and Donna, to figure out how to spend these monies. Because they can only be spent in certain ways. Mr. Gibson's not here tonight, because he would say, well, how can we spend it? I could hear him say that. What can we spend it on? So, but there are things. At the bottom, I did want you to see it, those 543 funds, $84,000 of that has to be set aside to pay for the rest of the medical mobile unit. I did talk to the medical mobile unit. I did talk to Matthew Specialty Vehicles a couple of maybe a month ago, and they are still waiting for the actual chassis to come in. Once the chassis comes in for the vehicle, they can start working on the vehicle, and she said it would probably be the fall, late fall, before that got into where it needed to be. So that's gonna go over for another year. So I know I feel like I've been doing this mobile unit for 2 years, which we have.
Yeah, that's true.
I will say, I talked to another health director at training, and they ordered the same thing for Matthew Specialty Vehicles, and we got a way better deal than they did. Theirs is almost $100,000 more than ours. It was the same exact thing, because we ordered ours early, and they ordered theirs later, so yeah, and there's $36,000 of that money allocated for this walkway here. If you see the walkway here all the way down, there's gonna be awning. It's gonna be all the way down to the curb where it will keep the rain and weather, where people are coming in and out, won't go to the weather. We did get approval from the state. I did get approval from the state to use these funds for that purpose, so I have that in writing. And we have gotten a quote, and the quote's right there at $36,000. Any questions? So that leaves about, $119,000 for that fund, and then $225 in that vaccine fund that we can expend next year. So we're gonna have to find creative ways to spend that money, because there's,
You get your cough drop?
no, sir, I'm good. Thank you. I appreciate it. Any questions on that COVID funding?
Yes, I understood, I think from Daryl, that maybe it's gonna be sitting around, nobody's gonna have the right categories of expenditures. They're gonna loosen up how you might be able to use it.
That is, if you ask me, I would think that that's probably true. Because the reasons, I think we have a spreadsheet, I have a spreadsheet, so it's up there, that has a spreadsheet on what you can spend the monies on and what you can't. It's an allowable, non-allowable expense. I do not know how you're going to spend $264,000 on something that's on that paper. I was fortunate enough to go ahead and wiggle my way through the guy on the walkway saying that if they're saying to get vaccines and there's a line, that they're standing in the weather. So that's how I got by with that. And also 2 benches out there for them to sit on end of the walkway. So if they need to have some kind of seating arrangement. So that creatively worked. If I can find other creative ways to spend the money, then we'll find that as well. I would love to be able to creatively find a storage solution with that money, because we currently have no storage. If the county let me I won't put a pods box out there, but if I had some type of storage unit and put COVID stuff in it, then it would classify as COVID use. So
And the storage box we do have now is not climate controlled, so a lot of our items we're a little hesitant to put out, like car seats and packing plates.
Could you justify that if there's, it doesn't have to be all COVID in there.
I think we can justify it. We haven't really sat down, and Amanda just been here such a short time. We haven't had a chance to sit
I
down.
bet you could justify it.
Let's lease the old
Heating and cooling.
Walgreens that closed.
Is that for storage bin?
There you go.
It's climate control.
I talked to the county, the county's looking for climate control anyway. We have asked, I've asked for, this is the second year in the budget, I've asked for a climate control space, and
Well, I think you could justify it, don't you?
I just know that First Health has used two of them. That they're using as clinics.
I saw
One is
that.
drugstore.
Road drugstore.
They sure
I think
do.
there's one.
There's one right there on number one.
That's it.
How many square feet you need?
You talking something that's beyond me.
Well, if you're gonna get a storage building, you need to go ahead and plan ahead and just make sure you can heat and cool it. But it's gotta be, and you can, as long as you put COVID stuff in it, I would think it would be justified. And, cause then you could use it for other stuff. Unless they say it can only hold COVID stuff.
From what I have dealt with in the past, as long as you've got something COVID related in that storage unit.
We
there's
put some
space.
mask in there.
I'm ordering the take-home test kits that we're gonna be giving out as a distribution site, so.
Yeah.
And my only issue is what storage site, how big, where you putting it at.
I get the biggest thing you could afford. I get the biggest thing you could afford. The biggest thing you could afford, because you don't wanna go small. Get what you, spend the money, as long as you got it. to
And the
spend.
climate control, I'm not so hesitant about the cold weather, I'm more concerned about the hot weather.
So
The cold weather, I'm not concerned with.
the hospital's building like a Butler building over there on the campus.
Mhm.
I think that's what it's for. I don't know if it's full or not.
That would
They
be
did
great,
the same
wouldn't
thing. We might could get some stuff over there for temporary. So you build something over here or
Yeah,
rent something else.
that's a great size building.
It is.
Are we talking about a refrigerator?
No, sir, I wouldn't say a refrigerator unit, I'm just to the point where I don't want stuff sitting out there at 110-degree temperature, because inside that Connex that we have out there, I'm sure it gets to 110, 120.
Exactly.
But Kevin or Parks and Rec, EMS has one out there that has a fan in it, like some kind of cooling device that's in it, because you can see it from the outside, there's some type of cooling device that's in there. So I'm not so much concerned about the cold as much as I am about the heat.
Well, I mean, wouldn't a refrigerator take care of it?
A refrigerated unit?
Yeah,
Yes, sir. that
just
would-
go down to Lowe's and buy a refrigerator and set it up.
I think Mr. Brody is talking about
It's big, yeah.
like big plastic gowns and stuff that kind of.
Like right now, out in that storage unit, which me and Amanda went in today, there's gowns, there's PPE, there's all kinds of stuff in there. And, it's okay, but for a while, sitting at 110-degree temperature, it's not gonna be worth anything.
And it smelled to me like mildew in there.
So there's water getting in.
So you really don't wanna put car seats and
Yeah,
packing plays and stuff in there that we're giving out to the public.
yeah.
And we do, fortunately or unfortunately, whichever way you want to take it, when they closed the vaccine site, they left all that stuff there, and that was our stuff.
Yeah.
So all that stuff
Do
is
you
there.
think there's room in that building over at the hospital, Dr. Carter?
We could certainly,
I have a meeting with Mr. Woods
You
next
could
week.
ask
I
and
could-
see, because it's air conditioned and heating, and if they even have a small space that the health department could use for a bit, that might be worth looking at. For storage.
they may have the same problem that we do though. We
Yeah.
got excess.
But look at
product.
that, if you go over there, look at that building from the outside,
We can certainly get
it's
something.
huge, and it would be great if the health department could have something like that for storage.
If they overbuilt it, then they may have had the same idea.
They're a little stingy
Overbuilt.
with their space though, I'm gonna tell you that already. Because when I was looking for a COVID vaccine site, Greg didn't want to have, I was asking if they had an extra office building we could rent, even if it was empty.
Yeah.
Somewhere to do the vaccines and the testing, and he didn't offer anything else.
How big does this thing need to be?
As big as you can get it,
Huh?
as big as you can get it.
Well, what about one of these little outbuildings that you see all up and down the road? Get one of those and put a big air conditioner in it.
It just needs, if they're gonna get space, they need to get space.
Yeah.
Because, a large space and heat and cool it, a larger building.
I just say there's a lot of unoccupied real estate that has HVAC in it.
Yeah, there is. That drugstore is it.
Storefronts and.
Cause you know what, if you needed another COVID,
We've got a small.
screening or anything, the parking lot, there's a drive-through area, that drugstore, the Walgreens, and over there, you can take your fried chicken and some kosher.
It sure is.
That's in a perfect
Yeah,
location. It's a shame we can't buy that building. That'd be a perfect extension way for the health department. It's in a good spot, very accessible.
Any other questions or comments on the COVID monies? I don't want to take up much of your time. The next part is just because we have not met and talked about the budget at all for this coming year, and we know they approved it today, I think.
Yes.
They approved the budget today, so I'm gonna go really fast through this, because I do not have the actual detailed numbers, because it was just done today, and I got the email on some of it later this afternoon. So just to show you for an example of our budget this year, upcoming year, compared to the past few years, our budget has now over 4 million in the health department. That's the first time it's been that way since 2010. So, the budget has gone up. And on the next page, next slide, you'll see kind of what we've requested. We did not request anything new. There's no new positions in the budget that we requested. Please note that 400,000, that 4 million there number there is because of this county's salary study. Because we do not know what's going to happen in November. If you're following the county, you'll know November, they're looking at they're doing a salary study now, but come November and January, they're looking at implementing that salary study. So they're projecting what people's salaries are going to be next year in the future.
And they're not going down.
No, sir.
No.
I guarantee you they're not going down. So, also you'll see that rollover COVID funding, which is just talked about, that money that's rollover as well. Storage solution office space, we just talked about a little bit. Once we get storage solutions, we can have office space, but some of our offices have storage in them now, and that's why we can't use them. Also, we have talked about a vehicle replacement schedule, which I'm trying to work with Kevin on. We have 4 Chevy Impalas, 3 are 2008, 2 are 2009. Most of them don't have over 100,000 miles on them. However, they are 2008 and 2009 Chevy Impalas. So at some point in time, they're going to have to be replaced. Also, we have a new environmental health vehicle we bought 2 years ago. Animal controls vehicles were bought in 2017. So at some point in time, they're over 100,000 miles. At some point in time, they're going to have to be replaced as well. And the environmental health truck, which sits out there, which is way over, I think it's 200,000 miles on that 2007 Silverado. So, any questions?
Say the budget is $4 million.
That's what Kevin Patterson has.
How much of the revenue is, to meet that, is county tax money, and how much of it is revenue generated here? And then, I know we get money from the state, now we get Fed money too, so.
County appropriations usually make up probably anywhere from 50 to 55% of that money. Last year when I have not had a chance to do that figure because I don't have that figure yet. Last year when I did that figure, it equated to about 8 cents on the tax rate. So I'm assuming this year is going to probably be somewhere around the same, maybe a little more. So, but I did see the county manager, the county commissioners went to 99 cents, I think. Did we go 99 cents or $1?
It's 99
I think it
cents.
went to 99 cents. So, out of that 99 cents, probably venture to say 7 or 8 cents on that 99 belongs to, is used to fund the health department.
So where's the other 50% come from?
The other 50% comes from us collecting fees, Medicaid, billing insurance, and federal grants and state grants.
And the COVID money's sort of off budget right now.
I try not to budget COVID money. When you see these budget numbers, I try not to put COVID monies in there because they're supposed to offset themselves, basically. They give us the money.
You're supposed to spend.
We're supposed to spend. Any questions? Okay, thank you for your time.
Okay, now for the first time, the board will hear from our new director officially.
I'd like to thank y'all again for the opportunity to serve as your health director. Tomorrow will be 3 weeks, and I have thoroughly enjoyed every day that I have been here. Some awesome staff to work with. We do have some minor things that we need to tweak. We are having a little growing pains, a little pushback, but we're getting there. I've been doing orientation, the county orientation and the health director orientation through the state. I have collaborated with, UNC Health Southeastern on Wise Women Grant and Breast and Cervical Cancer Program. Scotland Health with, the TB program. They provide our radiology services and also cervical services for family planning. So I've talked with them and reviewed the contracts, which I've got to get the slides to look at. I have a meeting with Mr. Woods next week, so we can discuss some other things that we can collaborate on with the health department and the hospital. Tim mentioned the billing issue. From what I can tell, it's at least 4 months behind, and that can be contributed to people leaving the agency and no cross training was done. I'm in the process of scheduling training through PureMD, which is our billing software, for them to come in and do staff training for Tim's department. And also from Ms. Deb's department on how they register the patients. Because if we don't have the appropriate insurance information, we get a lot of denials. And I would love to see at least 90% of what we bill come through on the first try, and that's not happening. So we're in the process of scheduling that. Kevin said we could close for staff development day once that's scheduled. I also see the need for some customer service training to be done. And part of the billing training is a super bill, to where the providers will also get training on how they enter things into the software, where the bill's generated. So we're working on that and trying to get that billing caught up so we can get that one in. Anybody have any questions? We do have several vacancies, and me and Sharon are working very hard on getting all those posted and filled. We've had several interviews for environmental health, which I think she accepted the offer today, didn't she?
Yes, ma'am.
So we've got one of those positions filled. We are also advertising for a temporary medical billing person to also help with getting the billing. And that closes
Tomorrow.
tomorrow,
The,
28th.
28th, yeah. The HIV case manager, that closes tomorrow.
Closes.
The job posting.
The job
Okay.
posted.
Do you have deadlines on when to get it in?
The billing? Yes, I have met with Tim on that.
So if you don't get it in, you lose it, right?
Mhm.
So
Medicaid billing, you have 365 days to get it in to, and they're 4 months behind. So. The training should, did Blake get back with you this
Yes.
evening?
He's checking on those dates. He said those dates were fine with him.
The last
Good.
week in July was what we were looking at.
I have a staff member who is actually going to start shadowing this week, that person, watching what she does. So that starts this week. Now, when you say 4 months behind, it's 4 months behind on some billing. Some stuff is, not everything is 4 months behind. Okay? Stuff that like STDs and stuff that we send off that are easily done. Family planning is our most difficult clinic because of the way you code it and stuff. So that's really what's 4 months behind, is those maternities and family planning stuff. So.
And Medicaid managed care has not been our friend.
Exactly.
let's sit on
That is
purpose.
true.
And I think with
That's
some of the
it.
well care claims, we had the wrong address. And Tim, did they resubmit it to the new address that we?
Yes, ma'am.
last week? So that's why those were denied. But Tim is giving me a report every week on what is being billed and how many denials we are receiving back. and how many denials have been rebuilt, so he's giving me a report weekly on that.
Any questions? So I was beginning to wonder if we were in a climate controlled environment. Thank you, Tim.
Well, the county, after a certain time, the county system is on a timer, so after a certain time, the air turns off.
Yeah, I'll entertain a motion to make sure it doesn't go off this meeting. Okay. Okay, so now we have some department reports.
Did any of you go, Donna, do you have the COVID report?
It's later on.
Does any board member have any questions about any other department updates before we go to the COVID-19 report?
So I guess the reports are in our packet for review.
Yes, sir.
And anybody have any questions regarding the reports? Or if I've got my packet, I could have reviewed it before tonight. That's not anybody's fault but mine. And the fact we didn't have mail yesterday. We were out of town Thursday and Friday, had the mail held, so I got Wednesday's mail, whatever, Thursday
I feel
mail.
like it's my fault still about the party.
Huh?
I still feel like it's my fault. We'll talk.
No. You send an email, it's all good. All right, so,
Does anybody have any questions about COVID?
How are we doing?
Average about 100 cases a week, the past 3 or 4 weeks. Our curve is very reflective of the states as far as cases up and down. So we, at this point, when the last spike hit, we're past that point that it started really going up the last time. So it's just sort of hovering around 100 a week. And I'll take that as a good thing.
What about skilled nursing? I heard there were,
We have an outbreak in one of those, and
yeah, I heard that.
they,
About the timeframe recommendation, are they saying still around 6 months for a booster between?
yeah, depending on which one it is.
Same with Durham.
You can do it up to 4 now, I think the third or fourth, depending on the immunocompromised status.
For the general population, adults, they're saying around 6 months, aren't they? Because it wanes after so many months and then to build it back up.
But we are at a medium level spread again in Scotland County. Because our 100 cases a week transfer over to 300 cases a week per 100,000 population. So we are at a medium. Now, the hospital, from what I can understand from talking to the infection control nurse, they're still not having a huge spike in admissions, so that's good.
correct.
They are seeing a lot through the ED. I think since our site closed, they're doing more testing at Scotland. They'll get a lot more reports from there than I did before. And a lot of people are getting tested because someone is asking them to have a negative to go back to work, things like that. We're going to try real hard to get that information out to the community partners and the industries that you don't need a negative to come back to work. Because it is sort of bottlenecking the system when somebody I see a person get tested 3 different places in 3 different days. You know, so it's, and eventually we're gonna be a distribution site for at-home test kits. So finish that paperwork today. So basically, when you go to find a test in Scotland, in North Carolina, it'll say we're giving out free tests on a certain day a week. And you can come out to it. Otherwise, it's been pretty steady. Not terrible. No deaths since February,
We received vaccine for the
Yeah,
children
under
under
5.
5 this week.
and the order is, the state standard order is out, so we can do under 5s now.
How much demand do you have for that?
we don't have a very high demand for it under 12. I feel like it's gonna be even less for under 5. We do have some under 12s that come in, but not that many, probably 2 to 3 a month. Purcell Clinic's doing a lot, they're doing a lot of vaccinating kids.
The under fives, do you know? Or they just
No,
started?
they haven't started.
They haven't started yet.
And the hospital's doing a lot, because I talked with Claire a lot, sometimes because they put certain limits, you can only order like 400 of a certain kind of vaccine, she doesn't need that many. So I order them and then share them with the hospital and transfer them over to them, so they're,
Does that mean they're clinics as well?
yeah, she gets them distributed to the clinic.
I think we can, feel that, quite a blessing that the virus we have now is not the one we had with Delta.
It's true.
And the other side of that is the vaccines we have are made for the original. So they're less effective. So at some point we have an efficacy issue and a risk issue. In the news in the last few days is that the CDC has admitted they have not looked at the vaccine adverse event report, the voluntary report. So, the final chapter's not been written on this little deal, but it's going the right direction in terms of people not dying and not being hospitalized. We have had 1 or 2 patients in the last couple of months that made it to ICU. I think we may have had 1 that was on a vent, that patient survived. So,
And the dates, that's my slide up there, that date, the 2/7/21, not that. That goes back to the beginning in 2020, March of 2020. So that's basically how our cases have fluctuated through the, you see it was.
so that's a January of last year. January 21 was our worst time.
It's not nearly, even the low peak is, we're not as bad as the low peak was.
And just FYI, North Carolina has 3 doctors with COVID right now. One of them just came back to work. Hospital policy is if you're 5 days and asymptomatic, don't retest, go back to work, wear N95 for a week or 10 days, whatever it is. That's what we're doing.
Yeah, and with the nursing home that has the outbreak, they were so short on staff, they had to go to an emergency plan. And people who had tested positive for COVID but were asymptomatic, I told them to assign them to the hall where the COVID patients were at, because they didn't have any staff to work, so that's CDC, you can do that. They're not gonna get the COVID patient sick, and they're not sick, they just can't go anywhere else in the building, just stay in that hall.
We had some COVID positives in our office too,
Patients or staff.
staff.
Yeah.
I've had some patients come in and say they had it like 3 weeks ago.
I think we're almost 100% in our office. We've got 30-some employees. I think everybody's had it at least once.
Wow.
But most of it, has been pretty mild. I mean, thank goodness, most of it's been Omicron. And I think we're not climate controlled again, but that's okay. Any more, you want to keep going?
No, I put that in your packet for your information as far as vaccinations and people vaccinated. You can look at that when you feel like it. Go back to the clinical one, Sharon, let me look through that, just make sure I don't want to bring something up. Look at, look at. So we did have a nurse resign, she's pregnant, she's gonna stay home after she had her baby. Okay, that's all, I just wanted to make sure. Amanda, are you gonna talk about the HIV thing that we're doing?
The case management?
Just so they'll understand.
Well, we're hiring is that a temp position? Yeah.
Part-time temporary.
Part-time HIV case manager. We're looking for a LCSW. to work with the HIV patients. You probably can tell them more
Yeah.
what's in the job description.
Yeah, we've had, so since February, with our HIV clinic that we had here back in February, we had 22 patients in that clinic, and now we have 40. We've had 8 brand new HIV cases in Scotland County in the last. So HIV is definitely, I don't know if it's been hiding during COVID, but it's coming to us now.
Were the numbers this high before COVID? Are these new people coming in?
Brand new HIV.
Are they brand new to the county or the people who moved here recently?
Brand new cases,
Not
period.
the-
Yeah. And the new ones live there, we've had some transfer in from other states, a couple of them that were already, had been diagnosed years ago. But these are all Scotland County residents. So that's we have an HIV case manager now, who we pulled out of our Betsy's program to do some, but because Betsy is short of staff too, and they're getting more cases and more cases and more cases to follow in children and pregnant women. So with the extra communicable disease money the state gave us, through an agreement with them, that they have agreed to let us hire an HIV part-time temporary case manager to help with the caseloads for HIV. So that's where that.
It's only 120,000.
Yeah, so it'll run out at some point, but, we'll have her until maybe who knows, we'll get some more money from somewhere. People to keep it. Gotta start somewhere.
Anything else with department reports? We got 2 items of unfinished business to attend to. You gonna help me with this?
Yes, sir.
Let's take them in reverse order, if that's all right. Provisions for health director residency requirement. Do we have a wording of a proposal, or do we need to come up with one?
I think the last time we had, talked about, a 45-minute radius from Scotland County.
So there's no wording from Kevin or legal or something?
No. Jason just asked me to put it on the agenda because they need, it officially.
Who asked?
Jason, the clerk to the Board of Commissioners.
Okay, all right. So the issue is that our current director lives in Marlboro County, what? 20 minutes from here?
Yeah.
Something like that. And our documents say you're supposed to live in Scotland County.
Yeah, that's what it currently says.
So I guess we can do this by simple motion, so that's what I'll ask for. If someone would say, would put in form of a motion,
Right here.
mileage radius, you think 45, what would we say, 45 miles or 45 minutes? Or
45 minutes.
45 minutes.
45.
Get my son flies a jet, he can get you in 45 minutes from Asheville.
Well, that's true.
Or 45.
He doesn't own a jet, though, he just.
Would you want to say 45 minutes or an hour? Well, would you want to limit it to 45 minutes, or would you want to say an hour, just in?
Or do you want to go by miles?
I think we're probably safer
With miles.
Yeah,
I think
EMS
they would
does
be
miles
nice.
for all their paramedics and stuff.
So what's their limit?
30 miles?
100 miles.
30.
Uh-huh.
That's what I work back.
I think most contracts, if you're dealing with even a non-compete and that sort of thing, you go by miles. And she's in no more than 20 or 30.
You leave the deer property 30 minutes, and that's in Scotland County, so.
Well,
How long does it take?
20 to 30 miles?
About
So
30
it
miles.
should probably really be mileage, because if you're out that way, that's halfway to Southern Pines is, Deer Park. So, and it can take, but from just there,
I think we need to say, I think miles are better, so what's the miles? Is it 50, is it 30, is it 45, whatever?
How far is it?
what is the
How far is it?
furthest
40 miles?
town someone may live in that would do this job
Because somebody,
outside the
because somebody
county?
like the county,
yeah.
they can get here.
Then it's what?
Lumberton, Pinehurst,
Lumberton,
So you're still looking at,
Maybe
like
Fayetteville.
30 miles.
maybe Fayetteville, look at the counties around us. Further.
I think within a 50-mile radius
So
would
you gotta do
cover.
about 45 to 50, if you can include Fayetteville.
I think 50.
I'll entertain a motion.
I make a motion that we amend that, rule to, 50 miles for the health director.
That's the second. Can't tell through all the sequence who's talking about. Okay, any further discussion? If not, all in favor say aye. Opposed? Guess we're not planning on being here forever, that's why.
Wow.
50 miles, okay, all right,
As long as it covers where she's coming from, I'm good.
okay.
Yes.
You want to tighten it up?
Almost changed it in the future.
18 and a half miles. All right, thank you. Now, meeting attendance. Do we have some data or?
So far, we have 3 members who are in meeting attendance jeopardy.
What is the current policy?
The current policy is if you miss 3 or more meetings, then you would be up for discussion in terms of you reaffirming your commitment to the board. And the board chair would normally reach out to you, by letter or in person to see if you would like to reaffirm or if you would like to voluntarily come on.
Okay, you can educate me on how that. I mean, is the wording that,
Yeah,
is that nebulous? I mean,
I did reach out to Jason. Jason, said the board chair sends a letter to that member. Whatever feedback is gotten back from that board member, if that board member does not want to stay on the board, then the board chair would then write a letter to the board of commissioners. Let me go back. The board of health would vote to remove those members. Then the board chair would send a letter to the board of commissioners asking them, let them know, give a letter of explanation, and then the BOC would then vote to permanently remove that person from the board of health.
So we have, is it 3 meetings over any period of time or is it over a
It's
year?
3 consecutive meetings.
3 consecutive meetings and a half, okay. So we have several of those members.
Yeah, 3.
And I guess we would consider, I think let's just hear the list.
Well, Mr. William Matthews is 1, Beth Hobbs and Dr. LeBee are the 3.
And how many of those are in positions that we are required to have, like the veterinarian?
He is in one of them, and Mr. Matthews and Ms. Hobbs are public members, so they hold the public members' appointment.
And we're required to have them, but that's a little easier to fill than.
They're a little easier to fill, yeah.
I don't know if we need any action on this other than to say I'll write the letter to those 3 people. And if anybody wants to make any recommendations or comments or whatever.
As long as I've been on the board, Dr. Labib had been very active, and all of a sudden, we just didn't hear much. He was on, from afar, through the system, but he wasn't personally here. And then it just faded off, and he was always a very active participant, so I would encourage him to
Yeah.
return.
We need him.
Yeah, I might
We
give
need
him a
that.
call. I might give him a call, Dr. Carter.
Well, Mr. Matthews is here, so does it really change, put him back in, active duty or whatever it is?
COVID created a lot of disruption. Mr. Matthews, if you want to continue to be here, then I will write you a letter.
You got to reaffirm your,
I just didn't know all this was happening, really. I didn't know I was gone.
Yeah, it's been a tough time, right? I didn't know. So what
Sir,
you say,
yes,
yes, or
you've
no,
been-
want me to go or not go?
I guess it'd be okay if you if you want to reaffirm tonight, or?
Well, I didn't know I was going. I didn't know.
No, you're not gone. You're not gone.
You're not going? But I wouldn't see a need for him to have to
I
reaffirm.
want you to go either.
Every time you hear, you ask good questions and have good comments, and that you've been a participating member, and I think this was just disruption from COVID, but we do have one who doesn't come. And there, quite frankly, there's thought about who we might put in that position, being someone that's somehow connected with the hospital to be here as a resource. But we're not, I mean, nobody's put me up for that, it's just a casual conversation that a few of us have had. But,
That would be a public member, so they would just need to fill out the application and submit it, and the commissioners will have to vote on it. I mean,
so it looks like we're down to,
one.
what we need to call.
We're even calling a meeting.
Does age have
That is
anything to do
a-
with
that is a-
No, sir. No, sir.
And Beth Hobbs is gonna get
it?
rid of this.
Both of us.
I think Beth kind of wants to,
Back out.
yeah, from what I've heard, she has a lot of, with new baby and.
I didn't know that. Congratulations. But to some extent, she's the county
She's the county finance officer.
finance person, is that a little bit of, nice to have her here as a resource, but there's a little bit of conflict too.
But it's a public position.
That's she's in the public member spot.
Is there an age bracket?
No.
You don't get off here you can't
You
reach
can never-
maximum age, no sir.
You have to be able to breathe and talk, sit straight and check.
All right. I will, with no objection, I'll take that as my instruction to contact the two of them and get the responses we think we're gonna get.
I'll draft a letter and send it to you for review and
Okay,
then, what you're gonna mail to them.
Yeah, we really need Dr. Ledee.
I may call them both, I'll just call them both,
Okay,
and then we can send them a letter.
Yes,
And
yes,
then we can
sir.
go with take whatever official action we need to do.
Personal call, I think, would be
Better.
appropriate before they get a letter, because they may take offense on it, so.
Yes, sir.
All right, I appreciate that help. New business. Carlotta, got something to tell us?
Yes. And I'll be brief before you all.
Yeah, we're gonna have to pay everybody 4 minutes of overtime already.
Okay, so I'll just be reviewing with you the child fatality prevention team report for our team, and the activities that we'll discuss are what occurred in 2021. So our team is comprised of mainly 2 groups and also community agencies. With the health department, they're mostly the care managers, the social workers, our nurse practitioner serves as our provider. We also have a health educator and myself being the chairperson. And then we tag team with the community child protection team out of DSS. So those are social workers who staff the Child Protective Service Unit. And also their director, Miss April Sneed. Our community partners include staff from law enforcement, the school system, Department of Juvenile Justice, Guardian Ad Litem, Domestic Violence and Rape Crisis Center. So these are community agencies that also work with the populations of the families that we serve as far as our case reviews. So this is just a review of our duties. We meet 5 times a year, and we review child fatality cases of children who were residents of Scotland County up through the age of 18. After the review, these cases are sent to the local review coordinator from the state coordinator quarterly. And unfortunately, we just lost our review coordinator to DSS. She saw a better opportunity there. So that position is going to be filled whenever that position in management support gets filled. And Ms. Deb and her staff will cover that in the interim. So during each meeting, each member of the team are sent letters. They're asked to bring any information, any interactions with this family. So we basically do a round robin, and it's like a case study to try to identify any system problems or gaps in services, that we could implement something to try to prevent any future child deaths from occurring. If there are any recommendations made, then these are forwarded to Judy Bowers, and she is the administrative assistant for the state review coordinator. And the review coordinator who was there for many, many years, she left in 2021. And the new state child fatality team coordinator started on April 1st, and her name is Carrie Young. In 2021, there were 8 cases that occurred in 2020. So you have to remember, it's almost like the year of the cases we review is the previous year that we review, because the current year's information is incomplete. And then there were also 3 cases in 2019. So just like with everything else, COVID put a delay in information being able to be received from various healthcare organizations. So that is the cause of the delay for that. So there were 2 premature deaths. Both of those were like 21 weeks old. There were 3 under age 1. One was 7 weeks old. One was 3 months old. And then the last 3 were over the age of 1. There was an 11-month-old, a 19-month-old, and a 12-year-old. So causes of death were prematurity, leukemia, co-sleeping with underlying causes of death, asphyxial death in an unsafe sleep environment, allergic asthma. 2 were due to acute respiratory distress. One was born premature and had in-utero substance use exposure, opiates, oxycodone, THC, and then there was one with influenza with pneumonia and also seizure disorder. And then there was one unknown. We were unable to get records on this child's death. The child was a resident of Scotland County, but the death occurred in Mecklenburg. And at that point in time, we had been able to receive any records from the hospitals in Charlotte. The one recommendation that we had is not a new recommendation. So that is to continue with safe sleep education from community facilities and agencies. The health department, across all departments, especially with peer management in our clinic, particularly maternity, we echo safe sleep constantly. The hospital collaborates with us on their women's health unit and labor and delivery, postpartum. However, there is somewhat, it's not a new category, but they're putting a name to it, and it's called impaired sleep. So this is where you see parents who are caring for children under the age of 1, and there may be a co-sleeping death that occurs, but it's because the parent was using substances, drugs or alcohol. Additional activities, we complete our reviews. We didn't have any subcommittee meetings due to COVID. And I presented the Child Fatality Prevention Team report to you guys last year virtually, and also to the Board of County Commissioners. And then these reports were sent to the state coordinator by June 30th of 2021. I added this slide in, so there's a correction that should be 2020 instead of 2019. So just looking at 5 years, the 2021 data was unavailable, just to give you some statistics. And pretty much Scotland's infant mortality rates are always higher than the states. But you have to keep in mind that too, we're a small county. So you can have a few deaths and it makes it look like, you know, we're worse, where in actuality we may not be. It's just the population. But, you know, considering the deaths that occur for our county size. So I just took the average, and we're 9.5 from 2016 to 2020 in comparison to the North Carolina rate of 7.0. And are there any questions?
Any questions? It seems like a huge jump between 2019 and 2020.
Mm-hmm. Of course,
Again, a couple of numbers really changed.
COVID, just the situation that has affected this as
You
well.
think it affected education and all that? Just-
Sometimes kids are in a safer environment in school, but they're home all day,
Yeah, that's true.
and it's made a difference.
Do we have correlates in other less advantaged counties that are comparable? I mean, you see this in the other poverty-stricken counties across the state?
I don't have that specific data, but I can look at, usually I compare with Richmond, and without having any specific data to make a comparison, I don't want to speak to that, but I can look at that in the future.
We do receive funding from the state for infant mortality reduction for that program for this very reason. And I think that grant is given to the top 16 or so counties in the state who have the highest infant mortality rates. So we do have monies and funds that are used for that. So, and Carlotta and them do use that money to educate the population as best they can. But ever since I've been here, the infant mortality rate's been high.
Thank you.
Thank you very much. Okay. Is there anything else to come before the committee? The board? If not,
Move adjourned.
I think, do we need a second? I think we gotta have a second, don't we? No second, no discussion?
No second, no discussion.
All in favor, say aye. Opposed? All right, thank you, and I apologize for my delay getting here. It's just
We'll take it.
poor receipt.